Hello, welcome back. Today we'll be looking at a very important topic, which is the elbow joint, and I'll be giving you interesting mnemonic to help you remember all you need to know about the elbow joint. My focus in today's topic or in today's lecture is to teach you how to write essays if you're asked to write essays about the elbow joint in your anatomy exam. Now, this is a question that can be asked in your anatomy exam. Describe the anatomy of the elbow joint. Okay, here's a mnemonic that I have been applying for joints in the body. This mnemonic can help you form outline when you're asked to write about the elbow joint. And this mnemonic is I talk about rows, I for introduction, C for type of joints, A for articulation surfaces, L for ligament and bursa, K for kind of movement, R for relations, O for blood supply, S for stop with clinical correlation, and conclusion. Now, for introduction, the elbow joint is a synovial hinge joint that connects the arm and the forearm, allowing flexion and extension. It is essential for the upper limb mobility and function. Now, T for type, the type of joint. The elbow joint is a synovial hinge joint that permits movement in one plane, which is the flexion and extension. Now, for A, we have the articulating surfaces. The elbow joint consists of three articulating surfaces within a single capsule: the humeral joint, the humeroradial joint, and the proximal ulnar joint. So we know that the articulating surface of the elbow joint includes the humerus, the ulna, and the radius. Now the joints formed between these three structures will help us know the articulating surfaces of the elbow joint, because the elbow joint consists of these three joints in one capsule. The humeral joint is formed between the trachea of the humerus and the trachea nut of the ulna. The humeroradial joint is formed between the capitulum of the humerus and the head of the radius, and the proximal radioulnar joint is formed between the head of the radius and the radial notch of the ulna. This allows pronation and supination. The next is a diagram showing the different articulating surface of the elbow joint. Now for ligaments, the ligaments and bursa found the in the elbow joint include the ulnar collateral ligament that stabilizes the medial side, the radial collateral ligament that stabilizes the lateral side, and the angular ligament that encircles the head of the radius, holding it in place. For both, this is a diagram showing the different ligaments. The green shows the joint capsule, the blue shows the angular ligament that encircles the radial head, the red shows the ulnar collateral ligament, while the yellow shows the radial collateral ligament. Now for bursa, the most important bursa is the olecranon bursa that reduces friction at the olecranon process. Now for K, which is the kind of movement, we have said that the elbow joint is a hinge joint, so it allows movement at one point, at one plane, which is flexion and extension, that occurs at the humeroradial joint. We can also have pronation and supination that occurs at the proximal radioulnar joint. Now, for extension, the tricep brachia and the acromion muscles help in extension. For flexion, the brachialis, the bicep brachia, and the brachioradialis help for flexion. Now for relations, the relation of the elbow joint is as follows. Anteriorly, it is related to the brachialis, bicep brachii, medial nerve, brachial nerve. Posteriorly, related to the tricep brachii, auricularis bursa, and ulnar nerve. Medially, it is related to the ulnar nerve and medial epicondyli. Laterally, it is laterally related to the radial nerve and common extensor origin. Now for blood supply, the blood supply to the elbow joint is formed by anastomosis from the brachial artery, the recurrent radial artery, the recurrent ulnar arteries, and the interosseous artery. So all the venous drainage follows its blood supplies. Now for innervation, the branches of the medial nerve, musculocutaneous nerve, radial and ulnar nerve innervate the elbow joint. One thing you should know that any nerve that crosses a structure must give a branch to that structure. If the ulnar nerve crosses the elbow joint, it must give a branch to the elbow joint. If the radial nerve crosses the elbow joint, it must give a branch to the elbow joint. It should be in your mind that any nerve that crosses a structure gives a branch to that structure. So for clinical correlation, we have the tennis elbow, which is overuse of a common extensor tendon, which is seen in the lateral epicondyle, which is known as lateral epicondylitis. So the mnemonic I've written beside it is let. Let helps you to know that the lateral epicondylitis and the extensor tendon all comprise all are all seen in tennis elbow. So it can help you to get any MCQ question that is asked concerning the tennis elbow. Then the golf elbow is medial epicondylitis and discoveries of common flexor muscles. We have the olecranon bursitis. We also have the radial head dislocation, which is seen in nurse made elbow when common in children due to sudden pulling of the arm. Now for conclusion, the elbow joint is a hinge joint with three articulating surface. It has a strong ligamental support and an extensive vascular supply. Now, if you don't need to memorize anything for you to conclude an AC in anatomy, I used to say this every time I conclude an AC, just know the function of that structure I talked about, you have discussed about, that can form your AC. Knowing that the elbow joint helps in the mobility of the forearm, you can just write, for example, that the elbow joint is an important joint in the body that helps in the mobility of the upper limb, and that can form your conclusion. And with this, you can get 3 points in your exams. So you don't need to memorize. Just always remember to conclude an essay. If you're writing an essay in any question you have been asked in anatomy exams, I hope this mnemonic have helped you. And another mnemonic in this video. So I want you to like the video, I want you to subscribe, click on the notification bell, and share. Thank you for watching.